We're talking about excretion, right?
That's right, urine and what it means.
It's all about the pee-pee.
It is,
yes.
You know, it's starting from a very young life. We're talking off camera how important it is to check your children's diapers for odor, smell, color, consistency of both poop and pee.
Yeah.
This is what we're talking about now is urine. You're not in trouble, it's urine.
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 Urine, right?
Sorry. I don't have nearly as many puns for poop as for pee as I do for poop.
You know what, you smashed it right off the top, so you're good. Let's start with the color.
So what's interesting is urine can actually take any color of the rainbow, really. I mean, some of the colors are far less likely to occur in life. This is what we're looking for, though, straw or amber-colored yellow. That's not too dehydrated or too hydrated. If your urine is too hydrated, it's almost transparent. Maybe you're drinking too much or you're a long-distance runner. So starting off with the first color of the rainbow, which is red. Usually it's not going to be that Kool-Aid red, but nonetheless, red can occur when we've got a major infection. Blood cells can accumulate and end up in the urine from the bladder or urethral tract. That's not good.
Right.
You want to check with your doctor at all times. Or even from such benign things as beets. We've all eaten beets and or blackberries, a lot of blackberries. So certain foods can actually turn our urine red.
Now, would you know the difference between this is an emergency and this is just beets? Like, would it hurt when you're urinating if it's that color?
You typically would feel some pain, with the exception of guys who have prostate issues. So prostate cancer, and you don't feel that, and it's coming out as blood in your urine. But typically, if it's a urethral tract infection or UTI, you're going to feel it. A lot of women know how that feels. It's like peeing shards of glass.
It's
terrible. So it's horrible. Yeah.
Yes.
Could be an upper kidney infection. The point is, one little drop of blood, one drop of blood will turn the whole toilet bowl red. Anytime you see that, it's off to the hospital or doctor.
Got it.
Yeah.
Okay.
So orange, and I'm not going to pour as much in, otherwise I'm going to
lose all your pain.
Lose all my apple juice. Apple juice, folks. So the first segment was clay. This is apple juice. Don't get grossed out. Hopefully you'll continue to drink apple juice. We're more of an orange color. This is usually a problem with the liver. So liver congestion, liver failure, cirrhosis, hepatitis. And that's got to do with something called bilirubin. So that orangey color. But it can also actually occur when you take senna. Or senna leaves. Senna is used to make you go. It's a laxative. But that can turn the urine orange as well.
Okay, so you might know if that's what you're consuming.
That's
what it's about.
That's right.
What about, is this green?
So red, orange, and then of course yellow being normal, green. So that is usually a very rare type of bacterial infection, okay?
Yeah.
So we got to check, I can turn green.
Very rare.
And literally that green. It's a very rare bacterial infection, okay? All right.
So we're not talking about asparagus here.
No, well, actually, you know, asparagus turns, we'll talk smells next, but asparagus, and it's a gene. It's a really funky genetic factor that some people do and some people don't. I certainly do.
Yeah.
But that doesn't keep me away from asparagus. So healthy for you and your
good.
heart. Absolutely. All right, so on to the next color, blue. What the? That
actually happens?
But it's rare. I mentioned some of these are more rare than others. Blue, it's actually called blue bag or sick bag in the hospitals because when you have a catheter up to allow some hospital patients to go, either you have major problems or coma, then you have a blue bag. That represents a very serious infection as well. So we got to take the catheter out and switch the bag and of course get you on some rescue meds.
Okay.
All right. And then purple, literally this can be a situation of failure, liver failure, kidney failure.
Wow.
All right.
So nothing is getting cleaned out in your system.
That's right. Absolutely.
Okay.
Yeah. And another thing, by the way, from blue or purple, they're kind of interchangeable. So major failure, major bacterial infection. But blue can also occur. It's called blue diaper syndrome. Blue can also occur from what we call hypercalcemia.
Okay.
Or high blood levels and body levels of calcium.
Oh, really?
So all kinds of funky things here. Yeah.
Call everyone on the emergency list if this is
if
what
any
you
of this,
see.
this side of the rainbow,
911,
you're in trouble.
the hospital, doctor, everyone. This came in my bowl.
That's right.
Just really quickly about smell, the smells that you need to look out for when it comes to
You mentioned asparagus, that's not a concern at all. But if you smell musty is a problem. That's a metabolic failure, possibly liver failure.
Okay.
If it's sweet, you would be able to guess what that is. I mean, that's diabetes or high blood sugar levels.
Got it.
And then, there's all kinds of different odors, but if it's really off or it's extremely malodorous, it's probably a urinary tract infection or a kidney infection. Okay, possibly even a yeast infection that's transferring off into the urine or bacterial vaginosis. But